Hey there, this is Jenny Chen. I'm the founder of 3D Heals. Welcome to the Lattice podcast, the official podcast for 3D Heals. This is where you will find fun but in-depth conversations with technological game changers, creative minds, entrepreneurs, rule breakers, and more, focusing on how we can use 3D technologies like 3D printing and bioprinting to reinvent healthcare and even life sciences. This podcast will also include AMA or Ask Me Anything sessions, past Instagram live interviews with influencers, and other direct engagements with our tribe. Well, it's morning for me. I think it's pretty late. It's the end of the day for you, right, Firoza?
Yeah, it's about 10 p.m. Yes.
Okay, I think it's time, so we should just get started. Thank you so much for joining us today, Firoza. I want to introduce you first. You're the co-founder of Anonymize 3D, which is essentially medical 3D printing spin-off of a larger 3D printing company. You studied biomedical engineering in school, and you became very passionate about doing everything with 3D printing in healthcare, and you've done a lot of projects. You've done over several hundred projects. That's amazing, just for such a short period of time. So I'd love to, hear more about what you do on a daily basis. And I know you also brought us some really interesting cases and maybe even showing us around your office, because I didn't, we don't get to travel anymore, which is really sad, but maybe we'll get a tour today.
Yes, exactly. I mean, I'm really excited about that part because ever since COVID, we've stopped having too many visitors, and now I really want to show people around, and I don't get the opportunity. So I guess with this, I'll get that opportunity as well.
Yeah.
But yeah. Thank you so much for having me here, though, Dr. Jenny. I've always been very respectful of your work and how you bring everyone together, and it's just really nice to be a part of the community. And yeah, I mean, speaking a little bit about my journey, it's been about 6 years now. And we started off in 2015. I had just recently graduated and I had absolutely no idea what I want to do in life. I had studied biotech, and in biotech, I realized that I don't really want to do lab work, tissue engineering work in the lab. So I was out there finding things that interest me, things that would keep me motivated every day. And that's how this opportunity came into the picture, wherein a bigger 3D printing company, which is called Sahas, they said, we don't understand the medical side of it, we don't understand anatomy, and would you like to explore? And I said, okay, let's give it a shot. And something which is very close to my heart, ironically, the first ever case that we executed was that of a heart. And I do have that case to show over here. And if you will have a look, this is a really small heart. I don't know if people can see, but it's of a flexible material. And when I rotate it, and we can open it up and we can see the inside. Now, to give you a backstory about this, I did not know much of designing, but really had to put in the nights to understand the radiology aspect of it. We never really learned radiology in college, but had to learn that, had to learn the software. And we were really nervous because the surgeons also for the first time were trying out 3D printing. We ended up executing the case. We gave them the 3D model. It took us a while to get used to 3D anatomy in the hands. And mind you, this was the first time that 3D printing was being used in soft tissue modeling overall, not just pediatric cardiology, but soft tissue overall in India. So it took us a while to get used to understanding the anatomy outside of the patient's body. And this patient was actually rejected for surgery everywhere else. And they were not sure if they can go ahead and perform such a complex surgery on this smaller child. When the model went in their hand and they started understanding it better, they realized that not only can they do the surgery, but they can also do the most optimum surgical procedure for this patient, so that this child will have a longer life and will not have to go in for an operation again in a couple of years. So that's where it all started. And post that, we ended up doing a lot of different types of cases, not just pediatric cardiology. I have those as well if you'd like me to show those to you.
Yeah, but before we go away from this part, you said this is actually from a child.
Yeah.
How old was this child when he needed or she needed the surgery?
In 2015, April or June, he was about 6 months old.
So he was very tiny. So this heart is
He was,
actually a much larger model of his actual
yeah.
size, right?
No, this is actually life size. This
Oh,
child had
but
an enlarged heart,
he
but
was
you
six
can see that
months.
it fits in the palm of my hand. Yeah.
Uh, okay, I guess 6 months you can have a heart that size. So it is
Yeah,
a life
it
size.
actually is. I have seen some adult hearts as well, and when people tell you that it's the size of your fist,
Yeah,
I do not believe that. I do not agree with that. It's way larger than what I learned back in school, but now when I'm actually seeing it live, I was shocked when I saw this bigger heart in a child
right. Well,
because
maybe
that fits the size.
also there is a possibility. I mean, perhaps it's because the heart is abnormal. So they, when the heart is abnormal, sometimes they get bigger.
Yes, absolutely. So this is an enlarged heart. I won't deny that. But there are a couple of normal cases also we worked with for educational purposes, and
Uh-huh.
we saw them being closely this size, maybe a little lesser.
Okay.
But yeah, the sizes were close to
So
this.
that's false. That's false news. Don't believe that it's the size of your fist. It could be bigger.
Yeah, it's not.
Yeah. No, we'd love to see some of your other cases.
Oh yeah, I have a neurosurgical model which is more of a jigsaw puzzle. So this is basically a dural tumor. Here you can see the veins in blue and it's sitting right on the brain. Now here the surgeon wanted to see how far the tumor is from the adjacent veins.
Yes.
And he also wanted to see how deep the tumor is. So how we made it was we made it in multiple pieces like a jigsaw. So you can actually remove the tumor. And when you put this back, you can see the depths all the way going down. So this is another model that was designed for I think she was 63, 64 years old. And I can't put this back myself. I've designed this case myself and I can never fit this jigsaw puzzle. But this is something that it really helped the surgeon understand whether such an old patient can actually undergo such a complex surgery without facing too many complications post that. So
That's
this
very
was
cool.
yeah, that was a really nice case to work on. Um, then this is a scoliosis. So you can
That's
see
life
this
size.
was, yeah, that's life size. This child is about 14 years of age, like a teenager, and this is how
That's
complex
terrible.
the thing is.
That's a
Yeah,
terrible back. So everybody, this is your not supposed to be the way your spine should look. Yeah.
yeah. If it looks like this, then we really need to do something about it. But yeah, so this is one of the more complex finds that we see. If I can just bring it closer, you can see that the vertebrae, you can barely make the difference between the different vertebrae levels. So that's when things become really complex because we need to ensure that the surgeon can see where he needs to put the screw through the pedicle. And here, in a case like this, when it's in the OT, they can't see the pedicle, so they don't know what size of the screws need to fit in. They don't know in which angle the screws need to go in. So all of this pre-planning is done at back end. So I have another scoliosis case here with a jig. So this is another spine.
Yeah.
And I have a jig here of D12. So
Uh-huh.
I'm just going to quickly count down. D12 is the thoracic region and the last vertebrae in that. And this fits right there.
So this is a surgical guide. You actually produce a surgical guide along with a model for the surgeon.
That's right. So the process starts with getting the CT.
Yeah.
When we have the CT in a 3D format that we've converted, we actually see how thick the pedicles are. Pedicle is the part which connects the body with the spinous processes behind.
Yeah.
And we see how thick the pedicles are. What is the implant size that can fit through the pedicle? So we give the length, we give the entry point, the angle, and the diameter. We call it spine lead. It's a patent that we have filed for, a provisional that we filed for,
Yeah.
and that once has been planned, confirmed with the surgeon. We even suggest that maybe if they want a 6 mm diameter, we tell them that probably a 6 mm won't fit. Why don't you go for a 5 or a 4? So that those are the kinds of suggestions also that can be planned beforehand.
Yeah.
And yeah, and then we provide with these jigs.
Yeah.
Now we had almost all the surgeons come back and tell us that, we thought that we'll end up putting 14, 15 screws or something like that if we had done the surgery freehand. But with the help of the jigs planning, the intermediary spine, the vertebrae that we thought we would end up skipping, we were able to fix those as well. So now we are assured that the correction that the child is going to get is a complete correction.
No,
So
these are amazing, definitely life changing, and I'm really happy that the healthcare system is slowly adopting more and more. Now, before we go on, there are some technical questions from the audience. One is, what kind of software, hardware, and materials do you use with all the 4 different examples you have shown us? That's the first group of questions.
okay. So we use Materialize from Mimics. Sorry, we use Mimics from Materialize. Apologies,
Yeah.
it's been a long day.
Yeah.
But we use Mimics from Materialize. It's an FDA and CE approved software. And we have ensured that the protocols that we use on the software are correct enough so that the anatomy is not compromised. So at backend, we are assured that the software tools that we are using is at least giving us close to right anatomy. And as designers, as our responsibility, we ensure that the designs are right. So as a combination of those, that's the software aspect of it that we do. Based on for the hardware and the materials, depends on the application. If we know that the model is just for visualization purposes and it is for an external visualization like this spine model, for example, being in a country like India, where it is price sensitive, we
Yeah.
need to try and use low cost materials, low cost printers. So we choose FDM and we choose ABS material. When we know that it is a flexibility that they're looking at for a model like this, say for example aorta, wherein they need to put in the device, deploy the device and see whether the fitment is happening or not, we need a flexible material. So then we go for a polyjet or we go in for a Formlabs. And I'll show you all of these printers when I take you on an office tour, but yes, that's what we do.
Awesome.
When we are looking at where they want to see the nerves internally or where they want to see a deep-seated tumor, we go in for transparent SLA materials or again the Formlabs printers. So we play around depending on what kind of application the surgeon requires, and accordingly we consult on the final material that would help them.
Awesome. And for those people who may not be watching the video rather than listening to the podcast, I just want to say that Firoza just showed us quite a few more other models. So maybe you'll be interested in tuning to the video version of this as well. But one thing I do want to talk about is how anonymized 3D works with the healthcare system. Is very unique. Well, first of all, the Indian healthcare system is very different from the US and the UK, maybe. Definitely, probably. So the way that you guys work with the hospitals and doctors so that you can accelerate adoption of 3D printing is very unique. You want to tell us a little bit how you work with them?
Yeah, for sure. I mean, I've visited US, I've visited Canada, I've seen Europe, and I have seen a major difference in the way these countries operate. In US, Canada, a lot of investments go into developing new research, whereas in India, it's slightly the opposite. We have to do as companies, we have to do our own research. We need to get the products out there. And once a lot of people have adopted it, that's when the scaling up is faster. One good thing about India is that there are a lot of people. It's a 1.3 billion population country. So we have a lot of volumes. So we have a lot of cases. Being a developing country as well, not being in a slightly lower socio-economic strata also, we see very complex cases over here. So in order to be able to cater to that, we have to first work as a company, we have to work individually with the surgeons. We have to understand what are the problems that they are facing today, which are not being solved in the existing medical environment that they have around. One of the positives about India is that the doctors are amazing. The kind of hands that they have, the kind of expertise that they have is really, really good. So how can 3D printing provide them with something extra that they were not able to do with their expertise before this? So that's why we really had to dig deep into the most complex types of cases that they would want to work on, understand their psyche, go attend surgeries with them, go and see what is it that the problem that they're facing, come back and try and solve that problem for them, give them a solution basically. Once that solution is provided through word of mouth, a lot of it spread, more and more surgeons wanted to try it. Having worked at the ground level, now is the time when the hospitals have started showing interest in this as well. So now is the time we believe is for scaling up the industry. Of course, you need the right experience, you need the relevant credentials, but now is the time where hospitals are also seeing value in this. So for that, it's last year that we started tying up with hospitals as well, providing these services in-house, setting up a 3D printing lab with a 3D printer, with a software, and with a designer of our own, which can provide these services and run the labs for them. So in the last 6 years, we've seen that growth going in from the end user going towards a solution provider, and now through this entire chain, we are hoping that we can scale up the business as well. And of course, value is there, but there's also a business aspect to it. So doing good over here and getting the business will help us continue forward. So yeah, that's where in a country like India we've been able to grow up because of the kinds of cases that are available to us.
And the latest news from Anonymized 3D that you guys are working with Max Healthcare. What is
Yes.
Max Healthcare? What's the significance of that?
Yeah, Max Healthcare is the second largest chain in India for a hospital healthcare ecosystem, and they actually even went for an IPO this year. But yeah, so they are the second biggest chain across the country. The relationship with them is that any of their hospitals requiring a 3D printed model, we have a lab set up right there. So what happens is that, as I said, that we have a printer, we have a designer, and we have the software. The designer can just walk up with his laptop to the cabin of the doctor and tell him that, okay, this is the case that you've sent me. I've designed this for you. Can you just approve this? And I'll go back and print it. So once that approval has been given, we go back, and in a span of 4 hours to 24 hours maximum, an entire surgical plan is available to the surgeon to use in the operation theater. So one, it has given direct access to the surgeon. Two, the surgeon would want to utilize it to think differently also many a times. So they might think that, okay, until now I was doing it this way, maybe with the help of this, I can change my plan a little bit and let me experiment to give a personalized approach to my patient. And third thing is that it's right there. They can tinker it whenever they want. The timelines are reduced. They can work on emergency cases also using 3D printing, which was not easily possible earlier. And now another good news is that we've tied up with Apollo Hospitals also. And Apollo Hospitals is the first biggest chain in India.
Okay, the largest one.
Yeah, the largest one. So we have the top two hospitals adopting the technology in-house and wanting to explore it more for their patients and for their surgeons, which is, I think, great news for the community here in India overall.
Yeah, that's major milestone for sure.
Yeah.
When you have a larger hospital system buy-in. I wrote quite a few blogs about how to put 3D printing center in hospitals. And one of the major challenges is to have the talents, to find the right talent who can do the work. And you guys basically try to solve that problem by providing that talent, providing that infrastructure, so the hospital don't have to spend extra money on setting up their own printer. Managing printer is complicated, especially, when it comes to the soft tissues and, polyjet and larger machines, it's going to be pretty complicated. Are you guys doing metal 3D printing, by the way?
We are not doing it directly within our umbrella, but our sister company, which is called Incredible 3D, which is also an investor in Anatomize 3D, they have the metal 3D printers. So with their expertise in metal, with our expertise in design and polymers, together we go out in the market and we at least try to provide the end-to-end solution how much ever we can. So they are the only company in India which is ISO 13485 certified and ready for FDA certification as well. So being partners together, that's how we go out and we're providing those solutions.
Yeah, no, that's amazing. I love it. I love that idea. It's very creative. And the one thing I want to talk about you first is you, when I first met you in San Francisco, you're super energetic. You're traveling all over the world, literally. And so you must have observed a lot of different healthcare systems and then try to think about how anonymized 3D can fit in.
Yeah.
What do you think of the US? I mean, is it possible ever that for the US to have a company like, or you come over to the US to provide this kind of in-house service, just set it up for them and you run a 3D printing center and then do work for them?
So honestly, that was the plan. When I met you in 2019 October, I guess September October, that was the exact plan.
Yeah.
We were speaking with a lot of people to help them set it up. One of the good things about US is it is so open to technology. It is so open to bringing in new things in-house and experimenting that becomes very easy for us to go and approach them. What I was hoping for was to bring in the expertise directly so that they don't have to spend time building on it.
Right.
So that was the idea, and COVID did not help me execute that very easily. But what I saw in the different healthcare systems is that the approach is very specific to a problem, which is a research-based project which they want to work on. And that definitely has potential to expansions to different types of cases, which is something that I believe can happen. So a couple of universities or medical institutes, they have printers in-house. With that, they have a specific problem that they're focusing on. And then the rest might require more intervention. And that's where I believe companies like ours can come in with a wider portfolio to help them execute that also faster. Because half the infrastructure is there, it's not too difficult to build up on that, but it's the design expertise that needs to be built up on as well. So definitely there is a huge potential for companies like ours or Anatomize 3D itself to walk in and help grow that business. Just waiting for the right time now with the pandemic that's so dynamic, we don't know what's going to happen next. So.
No, it's great to hear that this is still an option on the table, that we can have this kind of business arrangement, because a lot of hospitals don't have 3D printing centers at all.
Yeah.
So you're talking about the ones that already have it, which is academic center, larger hospital usually, but you know, larger healthcare chain here in California, like Kaiser and Sutter Health, these are big healthcare system. I don't think people even know what 3D printing is.
Oh, really?
Well, maybe Kaiser, but I'm not sure about Sutter Health. But anyways, if you're out there, give us a call.
Yeah. Yes.
So we're ready for a tour. Are you ready for a tour?
Yes, I'm excited.
Awesome.
I'm just going to apologize in advance. My office is a mess post-COVID. Yeah, you can see all the boxes here. They're just face shields, goggles lined up. But the first thing that I would like to show is the new Form 3L that we have, the first one in India, which is right here. And we are really excited to use this. We're just waiting for a couple of more accessories that will come along with it.
What's the difference? What's the difference between this new version of Form?
So Form 3B is a smaller machine which can run all the medical prints, but this is literally double in size. Nice. So at the same technology of getting the kind of quality of parts that we need, we get this in a bigger fashion as well. Form 3B would restrict us a little bit in terms of the size, but not this one. I'm sorry again, as I said, that the office is messy, but these are a couple of small desktop-based FTM printers that we have. Mm-hmm. And we have reconstructed mandible, which is a free fibula case being printed right now.
Nice.
Yeah, so this is a case that needs to go tomorrow. So the mandible is getting printed in FDM, but we have the jig being printed in another Formlabs, and I'm just heading there.
No, I have a
Sorry.
question. Right now it's around 9 o'clock at night in your office.
It's 10:15, I guess.
Oh, 10:15. Oh my God. But
Yeah.
this print is going on.
I do have some people in office, but yeah. So now these are the industrial grade SLA printers, what you see. So
Yeah.
we have a partnership with Union Tech. And when I go in over here, you can see what's getting printed. We have about 200 dental aligners being printed right now. So
Nice.
I don't know if you can make out the shape, but yeah, I guess
Yeah.
now would be easier. Yeah. So if I just, okay, this one's locked. I'll show it to you in the other one. This one's also printing dental aligners, but you can see in this SLA machine, you can see the laser pointing out to the white resin.
I'm just surprised that you can just open a door like that.
Oh yeah, you can. You can't do it in all the printers, but this printer you can.
Okay.
So yeah, that's what I wouldn't do it with the Formlabs, which is right now printing a fibula guide. And I'm not so sure if you'll be able to see it either, but this is not something I would risk opening.
Yeah.
So these are the smaller DLP and LFS based printers that we have. That's the FormCure Form Wash and another 3D Systems SLA Viper 2, which is really old, but it still works. And I guess something's getting printed there as well. Sorry, I just lost the Wi-Fi when I was switching from one place to another. But, and
No
this is the
problem.
color. Yeah. So, I'm sorry, I can't. Yeah, this is the color jet printer. Here is the printing station and here is the cleaning station. So right now it's not working. I mean, no prints are running on it.
Yeah.
But yeah, these are all the set of printers that we have here.
You guys pretty much have all the polymer machine under the sun, basically.
Yes, so when my parent company Sahas, when they started, they were the first ones to have taken a color jet printer. People rejected the technology, but for some reason Sagar and Saurabh were really up for it. So we ended up taking that, and from then we just started scaling up on newer polymer, all the different types of technologies coming into polymers. So in terms of polymers, we are end to end providing whatever is required. But I hope you enjoyed the tour. I know it was quick, it
Yeah,
was messy,
that
but
was amazing. I always
yeah,
wanted to
it's
visit India, but obviously pandemic stops everything.
yeah.
But hopefully I can visit you in person one day. We have a pretty vibrant community in India. Let me just see if there's some questions from the audience anymore. Lots of okay. One person is asking, do you have any experience with bioprinting?
Unfortunately, no. And ironically, that was why I started 3D printing because I'm a biotech engineer myself,
Yeah.
and working with tissues was something that. And when I read about organ fabrication, that is what got me interested into this. But I guess we need to take baby steps towards bioprinting. There's still a lot that needs to be researched on, needs to be validated before it can go to that level. I guess just as a business call, I'm waiting for that before we step into bioprinting. It is definitely on the agenda. If not bioprinting, I don't know what I'm going to do. But I'm just going to wait a little while before we can head into that. So just to clearly answer the question, no, we've not worked on bioprinting products yet, but it's definitely something we're going to work on in the future.
Yeah, because your background is from biotech. It makes sense
Yes.
eventually.
Yeah.
So now it's interesting to. I'm always very fascinated with India market because one is very unknown to me, and two, it sounds like there's so much potential. But when we talked last
That's it
time,
for
you
this
were saying that
episode.
the market is
Be sure to
actually
follow us on
smaller
Facebook,
than the
Twitter, and
US for
Instagram at
sure,
3D
and
Heroes, and check
it's
out the
not
links
as
in the
big
show
as we
notes.
imagined.
See you next time.
Now, has there been any change in the last couple of years since you started working?
So I guess I would like to just rephrase that. The market is smaller in terms of the commercial scalability because a lot of the times, as I said, the country has some very skilled surgeons. So if you're just looking at purely, say, the basic of 3D printing, which is anatomical models, a lot of the surgeons might not need it in simple to mid-level cases, right? They would require it in some very complex cases. Now, these complex cases, given the geography of India, majorly end up coming from a lower economic society. So with that, the commercial scalability of it is lesser. The volumes are really high. There are a lot of patients going out there who require these services. But the thing is that the printers cost the same in India and cost the same in US.
Right.
Probably a little more in India because we are looking at shipping and imports and all of that. So the materials cost the same there, the materials cost same over here. So even though we do want to look at reducing down the costs and provide those services because there is a volume that can be catered to, we can't because we are restricted on the OEM hardware and software side. So I guess that's what I meant when I said that the market is smaller in terms of commercial scalability as of today, till we have the printers which are slightly cheaper, the raw materials are cheaper. Here people operate very quickly. So if a case comes in today, they might even look at posting the patient tomorrow. So if you're even able to reduce down on these timelines, that's when also the scalability will increase. And that's what we are trying to do with incubation centers, is that if we are in-house, we can reduce down on the time, eventually also leading up to increasing volumes. So along with being a scale up of technology, it's also a scale up of the business aspect of it.
Yeah, no, I can see many ways to play this in the future in terms of a business model. And has the government helped out at all in any fashion? Is there some kind of reimbursement pathway in India as well for this?
So there are two ways to look at this. One is if I bill it individually to the customer, then no. But if hospitals are billing this to the patient, then yes, we are seeing a lot of insurance companies reimbursing that cost for the patients. So there is no written rule, there is no set format which says that yes, if this falls under this category, this will be reimbursed. It depends on from insurer to insurer. The government has started taking, from the last time we spoke now, they have started taking measures and have started seeing 3D printing as a big, as something very valuable to the healthcare industry. We are seeing some steps down south wherein they've invested themselves in a setup for people to utilize around that city. So yes, there are definitely measures coming in. It will still be a while, maybe a year or two still till we see full support. But it's amazing that they've at least started noticing how useful this technology is for them.
Yeah, absolutely. I have some audience questions here. One person's asking, what drives you? What is the motivation behind your current work?
This is something that I've been trying to answer for myself as well for a very long time. What I realized that two things drive me. One thing is a problem, something that requires solving. That is something that I know that I will deep dive into and I will go and do that. And second thing is making anyone's life easier, making anyone's life better. And both of them together combined, if it's in healthcare, you can do both. You can solve problems and you can make someone's life easier, better, not worth living, but living in a better format. So putting these two things together that drive me, healthcare automatically, plus being in biotech, healthcare automatically became something that I wanted to get into. And 3D printing lets me do that individually for patients and every single time give them a different solution. So I guess putting all of these things together, it just makes sense for what I want to do.
No, that's very thoughtful. Yeah, it's very thoughtful. It's both, it presents an intellectual challenge at the same time is meaningful from a humanity side. I think I echo that feeling.
I know you do. From all the times that we've spoken, I know that you share the same feeling. So.
Well, I think this is all the time we have today. Thank you so much for staying late in office to show us around, to show us the mottos. Thank you, Firoza, and I look forward to reconnect some other time soon.
Yes, thank you so much for having me. Bye. Have a good day.
Take care.
Take care.